America's election headquarters in depth tonight. We continue our series on the candidates and the major issues. This evening, Republicans and health care. As we approach the deadline for the current Obamacare enrollment period, one report states more than 1 million new customers have signed up for coverage on the federal exchange, and almost 2 million have renewed their plans for next year. Senior national correspondent John Roberts reports on how Republicans plan to replace the current law.
When it comes to health care, there is one thing the top Republican candidates all forcefully agree on.
Terminate Obamacare.
Repeal and replace Obamacare.
I want to stop it in its tracks.
Obamacare is a job killer.
Repeal every word of Obamacare.
But beyond promises to eviscerate President Obama's signature legislative achievement, what are the candidates' plans to replace it? Donald Trump, who has yet to release an actual proposal, raised eyebrows when he suggested he'd pursue government-funded universal health care for the uninsured.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
The pronouncement puts Trump absolutely alone on the issue. No other candidate is proposing the government pay to cover every uninsured person in America. While Trump says he'd make deals with hospitals to cover the uninsured and promises, quote, something terrific, he has no concrete proposals. Marco Rubio, Jeb Bush, and Ben Carson have actual plans. Ted Cruz has put forth a short set of principles.
We need common sense health care reform that makes health insurance personal and portable and affordable.
Trump does support selling insurance across state lines to increase competition, a centerpiece of Cruz, Rubio, and Bush's plans. Carson would allow it as long as the states, not the federal government, regulated quality control. Bush and Rubio would provide tax credits for people to buy insurance. Trump and Cruz haven't said. Tax credits are not in Carson's plan. Trump and Cruz like the idea of expanding tax-free health savings accounts, though neither has an actual plan. Rubio and Bush have both proposed expanding HSAs, while Ben Carson would create so-called health empowerment accounts with extraordinary flexibility.
One of the real key differences here with any other type of health savings plan is that we give people the ability to shift money within their health savings account, within their family. Your uncle, your grandfather, your cousin.
All the candidates support increased consumer choice in insurance plans. Trump is non-specific, but the rest would allow consumers to buy plans that suited their coverage needs, eliminating the minimum standards in Obamacare.
Buy health insurance from any company in any state in America, and the kind of health insurance you want, not the kind of health insurance that the government thinks you need.
The top candidates also all support coverage for pre-existing conditions, though Ted Cruz would rely on protections already on the books before Obamacare came along. When it comes to Medicaid, Carson, Rubio, and Bush have all proposed dramatic reforms. Carson would use Medicaid funding to purchase private insurance and fund health savings accounts for recipients. Rubio and Bush would turn Medicaid money over to the states to design their own health plans for the poor.
Let's let the states have the power to create a safety net we need for the 21st century and hold them accountable for the results they achieve.
There is still a lot the candidates haven't said about how they would do what they propose, but all have pledged to create what they insist will be a system far better than Obamacare.
You empower the patient and you keep government from getting between us and our doctors.
In order to get any of those proposals enacted, Republicans will likely need to run the table in 2016. Without holding the White House, the House, and a filibuster-proof majority in the Senate, undoing Obamacare will be a daunting prospect. Bret?
John, thank you.